Well, I think we're ready to start. So, good afternoon, everyone, and a very warm welcome to today's webinar entitled From Digital Strain to Digital Strength. Before we get started, I just wanted to give you a couple of pieces of information. First of all, the session is going to be recorded and it will be available on our website after the webinar in case you want to rewatch. And also, because we have a very short session today, we would kindly ask you to put your questions in the chat, and we will use some time towards the end of the webinar to try to go through all of them. I'm delighted to open this important conversation during European Mental Health Week, which this year focuses on the European Pillar of Social Rights. And it's a framework that reminds us that fair working conditions and access to mental health support are not just aspirations, but rights. This week is a critical moment to spotlight the mental health of our healthcare and care workforce, a group under immense strain and facing rising levels of burnout across Europe. Chronic stress, understaffing, and systemic pressures are being compounded by digital tools that, while full of promises, can also sometimes add a burden when not implemented with care. EPHA has been hosting, or will be hosting, this event in the context of the WHO Europe Strategic Partners Initiative for Data and Digital Health. And since June, EPHA has had the honor of co-chairing the Public Health Working Group within this initiative, a group dedicated specifically to the mental health and well-being of health and care professionals, seen through the digital lens. We're truly pleased to be joined today by two key figures in this work. Lynn Farah from the Health Ministry of France, who is the chair of Working Group for the Public Health Working Group, and Nancy Del Rio from the Hospitals Federation of France, who also co-chairs this group alongside EPHA. Together, they'll share insights from their group's latest efforts and help us reflect on what it takes to build sustainable supportive systems for those who care for us. But before we get started with the main discussion, we're pleased to welcome Fatima Awel from Mental Health Europe, who will guide us through this year's European Mental Health Week theme and present their newly released policy brief. Thank you for being with us and look forward to the rich and meaningful discussion.
Thank you so much. I'm going to try sharing my screen. Hopefully it works. I hope you can see my screen okay. Perfect. So I want to say thank you so much for the lovely introduction. My name is Fatima and I work at Mental Health Europe as Policy and Knowledge Officer. For those who might not be so familiar with us, Mental Health Europe is the largest European independent network organization focusing on mental health at European level, and we have over 90 members in over 30 European countries. And as just Emma mentioned, at Mental Health Europe, we've been running European Mental Health Week for a number of years now. This is the 6th edition, and each year we focus on a different theme. And this year is a really timely and important topic, which is on social rights. So we are looking at kind of how mental health is interlinked with social rights, as well as the necessity to preserve social rights when looking at improving the well-being of society as a whole. So we have seen over the last couple of years that indeed mental health has gained visibility on the political agenda, but especially in everyday discussions, especially in the wake of the COVID-19 pandemic. And although there is this visibility and increased attention, the overall situation regarding mental health hasn't improved. In fact, it's been worsened. And what it's done is it's revealed that our systems have a challenge and inability to meet the scale and complexity of mental health needs across the continent. So one of the core challenges that we faced and we push for in this theme is recognizing the challenge when it comes to the dominant model when it comes to mental health, which is the biomedical model in public discourse and also in policy. And we shine a spotlight on this because this approach does reduce the mental health to an illness that needs to be cured. And also what it does is it lacks the recognition of the socioeconomic and environmental factors and what it does to shape our mental health and well-being. So this is very important for us to recognize. And at Mental Health Europe, we've been working towards this answer for 40 years. We're actually celebrating our 40th anniversary this year. And our solution over these decades is really to push for a psychosocial model of mental health. And just have it on the screen, kind of some information as to what the psychosocial approach to mental health entails. But one of the what we do is we argue for a psychosocial approach to mental health, and recognition that our mental health is shaped by a variety of factors when it comes to life events, transition moments across the life course, as well as by wider societies, also looking at economic and environmental determinants, which act as a protective or risk factor. So what we do is we call for a mental health and policies approach, which is core to our work. And this is essential for improving mental health and well-being. And in such an approach, actions are taken to address mental health within and beyond the health sector. And this is really important because mental health goes beyond just purely health, with a strong focus on social promotion and also mental health prevention. So policies in different areas can impact positively on mental health by strengthening protective factors and mitigating risk factors for mental health problems. Conversely, the lack of sufficient policy provisions or changes to policies can adversely impact mental health and well-being. And I'm really happy that we're talking about the topic of digitalization, because digitalization is one of these key areas. And one thing that we point out and underscore in our work is when it comes to digitalization, there is a need to avoid simple black and white attitude and the importance of positive elements in discourse on digital well-being. Otherwise, what we do is we risk demonizing digital technologies and reinforcing prejudices, fears, and barriers to the development of digital competencies. So I want to kind of wrap up by highlighting that this year's campaign and policy brief, which you can find on our website, we do focus on the points that I've mentioned before. And we focus on demonstrating how the psychosocial approach can be adopted using existing tools, such as the European semester and the European Pillar of Social Rights, as well as looking at the next multi-annual financial framework, the MFF. The Pillar of Social Rights is a really important instrument for tackling socioeconomic determinants of mental health. And we include a number of recommendations looking at the three main areas of the European Pillar of Social Rights. So we look at equal opportunities and access to the labor market. We focus on fair working conditions. And in relation to this event, one of the points we include is, prolonged exposure to workplace stress. Psychological strain can lead to anxiety, depression, and even physical health problems. And this is, of course, in connection to being chronically online as well. And lastly, social protection and inclusion. So I want to finish by saying, please support our work, download, check out our webpage, which includes all the information on European Mental Health Week, as well as our policy brief. If you want to learn more about the psychosocial approach, download our toolkit, which is on our website. And of course, please do support our work. One thing you can do, for example, is subscribing to our newsletter. So I'll stop there, but I'm available in case you have any questions or would like to point anything out. Thank you.
Thank you very much, Fatima, for opening this session. I've just pasted on the chat the link to the policy brief in case people are interested in reading it. And I think now we can go back to our speakers today. As I was saying before, we have the chair and one of the co-chairs of the Public Health Working Group and their Strategic Partners Initiative for Data and Digital Health. Nancy de Jesus, would you like to introduce yourself?
Hi, good afternoon, everyone. Good afternoon, fellow colleagues. I'm Nancy De Jesus. I'm a Mobile Crisis Unit Coordinator and Research Intervention Coordinator for WHO Collaborating Center in France, located at the Paris. I'm sorry because it's in French. It's in Paris, Val-de-Marne hospitals, and I am a co-chair for the Strategic Partners Initiative since last year, together with Jai and Lynn Farah. Thank you.
Thank you very much. And Farah, over to you. Would you like to have the chance to introduce yourself?
Thank you very much, Jay, and good afternoon, good morning, everyone. So first of all, I would like to warmly thank you for making this event possible. So I am Dr. Lynn Farah. I serve as the Director of the Digital Mental Health and Aging Well Challenges in France, which are a governmental investment plan shaping the future of health and innovation. And I'm also responsible for AI, so artificial intelligence, in healthcare at the French Ministry of Health.
Thank you very much, both of you. And if you don't mind, I have a few questions to facilitate the session. So, Nancy, the first question is for you. And my question is, what does the current evidence tell us about how deeply burnout is affecting the healthcare workforce in Europe? And what are the broader implications for health systems performance and patient care?
Okay, so thank you for that question, Jai. And to begin with, burnout is not just a workforce issue. As we have seen since last year during our working group, it is now a structural risk to care quality, system resilience, and equity in Europe. Some key evidence that we have gotten since our working group of our SPEDDH review of over 1,200 studies, which showed burnout rates exceeding 40% among frontline health professionals in many European settings, especially for nurses, and also high-income countries which faces system overload and digital fatigue, while low to middle income countries in Europe struggle also with understaffing and policy gaps, compounding psychological stress. And so, WHO data and the European Health Union insights link burnout with reduced retention, increased absenteeism, and even avoidable patient harm, particularly in overstretched hospital systems. And so, I think the takeaway message for your question is that addressing burnout is essential, not just for health worker well-being, but to ensure safe, reliable, and equitable patient care. And if we continue to ignore burnout, we ignore it at the system's peril. Yeah.
Thank you very much, Nancy. And I actually have a second question for you. So, in your view, what is the core issue that health systems are currently overlooking or underestimating when it comes to preventing burnout among healthcare professionals? So, we don't want to, continue to just overlook this issue. What is the main things that we should be looking at?
I think that the most systems still underestimate the emotional cost of unacknowledged digital burden and the lack of worker voice in innovation design. Another insight is that when we've been working since last year about this idea, and that we found that only 20% of digital health intervention are actively involved in frontline staff in design or testing. And so the engagement and adherence were significantly lower in these cases. And another takeaway for your question is that if we want sustainable change, we need to center the human experience in digital innovation, wherein burnout prevention is not about more tools, it's about smarter systems that listen, adapt, and protect.
Thank you very much for your insights, Nancy. And that is very well connected to my next question, which is addressed to Lynn, because Lynn, our chair, has a really good profile for the kind of work that we do together, because she takes care for both work on mental health for the Health Ministry of France, but also AI and other digital tools. She has great expertise when it comes to the technical side of the work we do. And Lynn, my question to you is, how can digital tools be designed to address and not worsen these challenges that Nancy was talking about?
Thank you very much, Jay. I think it's an essential question, and I strongly believe that the way we design and implement digital tools must be guided by a commitment to serve those on the front lines of care. So it's not enough to deploy technology for the sake of innovation. I would say that the question must always be, does this tool reduce burden, improve working conditions, and enhance professional autonomy? So to avoid exacerbating existing challenges, we must embed user-centric, as Nancy just said, inclusivity and field-based realities into every stage of development until the evaluation and deployment of the technology. So this requires moving beyond traditional top-down approaches, and instead, digital tools should be co-developed with healthcare professionals, with their voices central to design, testing, and of course, iterative refinement. So when practitioners are genuinely involved, the solutions created are more likely to support clinical reasoning, streamline documentation, and minimize the digital noise that contributes to cognitive overload, I would say. So it's really fundamental to ensure that technology safeguards the psychological safety and digital dignity of users. We must maybe resist to the drift towards hyper monitoring and digital surveillance, which can lead to new form of stress and mistrust. But instead, digital health must be a space where support is the default. So when those tools are thoughtfully designed in this way, rooted in real needs and respectful of human values, and aligned with broader workforce well-being strategies, they can become part of the solution rather than an additional program.
Thank you very much, Lynn. So co-creating the solutions with the health and care workforce involved in the process all throughout. And I also, like something you said that resonated quite a bit with me, what you said about not assuming that our solutions will be perfect at the beginning, and the need for, constant reiteration and refinement until we make sure that the final product addresses the need that we are trying to solve. So thank you very much. I wanted to go back to Nancy. So we're thinking about using digital tools to improve the mental health of the workforce, and we're trying to identify the key systemic factors that contribute to burnout. What would you say the key systemic factors that contribute to burnout among the healthcare professionals sector especially are today?
Okay, so burnout, as we have been studying since last year, is a symptom. Its root causes are embedded in structural inefficiencies, underinvestment, and poor digital integration. Like in our working group, we have highlighted that work overload, inconsistent staffing models, and fragmented digital systems are top drivers across Europe. For example, if we have a little bit time, in Denmark, despite the advanced AI use, we saw resistance due to training gaps and ethical concerns, proving that innovation without support increases pressure. Or like in Catalonia, in Lebanon, policy gaps and underfunding blocked scaling of effective pilot programs, showing how good ideas fail in bad systems. So I think the real answer and the takeaway message is that we must shift from reactive individual burnout mitigation to system-level redesign. This could mean protected time, smart staffing, interoperable tech, and policies that work with healthcare workers, not around them. Yeah.
Thank you very much, Nancy. And this leads me to my last question for you, and then we will open the floor for questions from the audience. But taking everything that has been shared so far into consideration, my last question is for Lynn, and I wanted to ask you if you could tell us anything about the methodology that our public health working group under the WHO Strategic Partners Initiative for Data and Digital Health has applied to propose ways for digital innovation to successfully help prevent burnout and increase workforce resilience. So can you tell us a little bit about the work we've been doing together? I know the details, but what can we share with the audience at this stage?
Yeah, of course. So really happy to be able to share today maybe some of the elements of the methodology developed by the working group 4 of the WHO Strategic Partnership Initiative, which is really anchored in a holistic and I would say public health driven and multidisciplinary approach. So from the beginning, we recognize that burnout is not simply an individual issue, but a systemic phenomenon rooted in structural stressors and also policy gaps. So our approach began with an extensive mapping of the stress drivers, for instance, within healthcare systems, administrative overload, lack of autonomy, or poor digital integration, as Nancy highlighted, while identifying key levers for change. So we gathered also insight from diverse stakeholders, healthcare workers, hospital managers, digital health innovators, and mental health experts and policymakers from across several WHO Europe regions. And one of the strengths of this methodology is really the evidence-informed and participatory character. So I would say that we reviewed existing literature, we analyzed country-level practice, and we also incorporated real-world experiences through interviews of experts, healthcare professionals, and also private sectors. So this collaboration between public and private also allowed us to build maybe, I would say, a nuanced understanding of where digital intervention could be helpful and where they risk also doing harm, so if not carefully introduced. So rather than treating digital innovation as a magic bullet, we positioned it within a broader resilience building framework anchored in key principles of human-centered design, inclusive engagement, ethical and adaptive governance also, strong data protection and privacy standards, and ongoing also intersectoral collaboration and evaluation. So we really made it a priority to incorporate equity consideration to ensure that these strategies that we will be proposing, they do not inadvertently widen existing disparities in mental health and access to support tools. So maybe to put it in a nutshell, the framework that we develop aims to help countries and institutions, healthcare professionals, to translate maybe the high-level ambition into practical action and to create environments where these digital tools not only reduce stress and prevent burnout, but also reinforce the long-term mental health, motivation, and resilience of the healthcare workforce.
Thank you very much, Lynn. That was my last question for you. And I just wanted to reiterate that this is what we can share for now, but it's been a very systematic work methodology that we've put into this. We have 14 organizations in our working group that come both from the public and the private sector. We have NGOs, we have member states represented, as in the case of France, through Lean. We have different kinds of experts that bring the mental health, but also the technological side of expertise to our discussions. And we will be launching our blueprint in November around the WHO Symposium for Digital Health. So stay tuned. We'll be able to share more details then. But for now, if you're okay with it, we have a few minutes left. So I wanted to pass the mic right, so to speak, to my colleague Lola, who has a few questions from the audience for you.
Hello, so I'm Lola. I'm actually a trainee in politics and health at EPHA, and I have been watching a bit the chat to have some question for you, and I did have one for Dr. Lynn Farah. Digital tools are often promoted as ways to reduce administrative burden, yet in practice, they can create new stressor for those that are implementing them. Based on your experience, how can governments ensure that digital mental health strategy remain truly supportive for healthcare workers rather than becoming an additional layer of complexity or even a way to become a tool to increase the productivity of health workers?
Thank you very much for the question. I think it's an essential one. At the political level, what we are trying to put in place, at least on the French, I would say, with my experience on the French perspective, is in the meantime trying to develop these solutions with users and being user-centric. We have developed also, and we are working with a working group which is dedicated to the ethic and the ethical perspective of developing and implementing, evaluating digital mental health solutions among healthcare workers, but also for patients. And we truly believed in the first step of this group on the ethical by design approach of designing and also using these solutions. What is really important also at each stage of the development and the evaluation and the use of this technology is to be able at each level to introduce these ethical principles and questions. So that's why we have developed, so in the not only dedicated to digital mental health part, but in digital health in general, some key principles and recommendations on the European level during the French presidency of the European Union. So I think that if I remember well, it was in 2022, so 3 years ago, and we are trying also to reintroduce this principle into use cases which are dedicated to digital mental health. So in these stages, we are working on deliverables. So they are not already available, but we are working on it to ask the good question to be able to have in mind during the development and the use of these solutions in hospitals, in the daily life of each users, patients, healthcare professionals, and each type of users. So I think it's a systematic methodology going through first recommendations, but they are not useful alone. So recommendations and guidelines should be also approached through use cases and to see how we are also having this question. If we want to develop this type of solution and if we want to use them, what are the real questions that we are confronted to during the development of this solution and the use of this solution?
Okay, great. Thank you. I think I also saw a question from Nancy. I'm sorry, I didn't say your full name. So Nancy de Jesus. You witness firsthand the ongoing struggles within the psychiatric field, with government pushing to accelerate digitalization as a solution to these long-standing issues. How can we ensure this rush towards technology doesn't overshadow the deeply human aspect of mental health? It is related to the previous question for Dr. Lynn Farah. So what is your take on this one?
Okay, so in my field of work in psychiatry and mental health, we have come to understand that mental health systems, they don't collapse all at once. They burn out each caregiver one at a time. And so we are now in the preventive measures, and we are very much, in consideration of especially of workforce who were there, who are not really inclined into AI, into digital innovation. We, as much as possible, take time to form them, to accompany them, to support them in these digital innovations, because it's not, yeah, if we have the tool, it's not also immediate that everyone will adopt on it. So yeah, everything should be done into consideration, but still preventive. We should start to act now. That's it.
Okay, thank you so much. We did have one question in the Q&A, which was about having a link to see Dr. Lynn Farah previous work. So, Doctor, would you mind sharing a bit where we could find your recent research?
Yes, of course. So I've tried to send in the chat directly some links, one in English and one in French, because most of the part of the work are in French, but we have some publication in English, and we are translating the French one on the action plan. So the French one is 30 pages on the action plan, which is divided into 4 axes. And the first one is a link of one of our publication, really short publication in English, to just highlight this axis and where we are when we published it. So if you need any other information, for instance, on our call for project, which are dedicated to this course, I can also share the link if needed.
Well, thank you very much, everyone who joined. As I said, this was going to be a very short meeting. The European Mental Health Week agenda is packed. So I understand that people want to also join other activities, other webinars, other events happening right now. But thank you very much. This was super useful, very insightful. I'm very happy that you were able to save some time to be with us today. And as I said before, this is being recorded and will be available for rewatch later. So that's all from my side. Thank you very much and see you on the next one. Bye.
Bye. Thank you.